Well, let's go to news out of Melbourne. In the past hour or so, in Victoria is establishing a statewide system allowing parents to escalate concerns about the treatment of children in hospitals. Our Melbourne reporter Holly Edwards-Smith joins me live. Holly, there's been a rise in the number of concerning events involving young patients in hospital.
Simon, a rise of 43% in the latest figures shown in this report. A 43% increase in centennial events, over 250. A significant rise, but one the government say was expected and likely due to an increase of reporting. Despite that, they are launching a Safer Care for Kids Victoria. That's because of a 12% increase in paediatric sentinel events in the past 12 months, particularly around escalation and people not being able to identify deterioration effectively. So Safer Care for Kids will be working with particularly parents who have either lost children to these types of events or have had situations in which their children have been adversely affected by them. The government today couldn't give an exact timeline for rollout, but do hope that this can be launched statewide as soon as possible. Some of these initiatives include a 24-hour virtual consulting line, as well as proper thought-out methods for parents to be able to escalate the situation if they notice their children start to deteriorate.
The first action under Safer Care for Kids will be the introduction of a new statewide patient escalation system, specifically for children. This will allow patients, families and their carers to easily escalate concerns if they notice worrying changes in their child's or indeed in a patient's condition.
Alongside the Victorian Health Minister, Marianne Thomas, was a mother, Leah Watson. She lost her son, Mitchell, to a genetic condition when he was just 7. And despite his death not being a result of any centennial events, she did recall today a number of instances in which she noticed worrying changes in her son, whether that was physical or mental. And in certain cases, these were ignored and did lead to adverse reactions, which limited his value of life in his last few years.
This system, had it been in place at the time, I have no doubt it would have made the world of difference for Mitchell, and I'm confident that it will with families in the future.
Simon, the Victorian Government will begin talks with stakeholders on how best Safer Care for Kids can run throughout the state, but again, no exact timeline on when people can expect this to be in hospitals across Victoria.
Yeah, and a significant announcement, no doubt, there from the Health Minister here in Victoria. Holly Edwards-Smith, appreciate that. Thanks very much.